Welcome to this BTOG podcast. My name is Tom Newsom-Davis. I am the Vice Chair of the BTOG Steering Committee. I'm a medical oncologist treating lung cancer in Chelsea Westminster Hospital in London. This is part of our regular podcast series entitled BTOG Does, where we have informal chats with experts in their field, and we tackle the most important questions that we all face in the diagnosis and the treatment of thoracic cancers. It is important to say that the sponsors of BTOG do not have any role whatsoever in the planning, content, or delivery of anything we go on to discuss. So today's podcast is a bit different. It is BTOG Does BTOG. In other words, it's our 20th anniversary. And at the risk of sounding a little bit self-congratulatory and a little bit of navel gazing, I thought it would be really interesting to review what BTOG is and what it's achieved in the past 20 years as we get through our childhood to our difficult teens and into the joys of adulthood. And who better to join me than Sanjay Popat, who is the chair, of course, of the BTOG Steering Committee. Sanjay, welcome to BTOG Does.
Hi, Tom. Great to be here. Thank you.
So we're going to have a bit of a ramble through things. And I was looking through the list of questions I was going to ask you, which I drew up in advance. And the first line I wrote was, what is the point of BTOG? And I think I kind of meant really, what is the aim? What is the focus of BTOG? How would you sum that up?
Basically, it's to ensure that we are delivering the best quality care, best practice that we can to our patients. And that's not just in the treatment side, but in the diagnostic side and the holistic care and supporting our patients. We just want to make sure that wherever you are in the UK, you as a patient are getting the absolute best care because the doctors and the multidisciplinary team that are looking after you are the best educated that they can be and have full access to all the information that they need to provide the best service to you.
So education, big thing. What do we do apart from education?
Yeah, so I mean, our mission is really to deliver this through three main pillars: education, facilitation of research, and representation. And they're the three cornerstone aspects of everything that we do.
And looking at our numbers recently, looking at the BTOG annual conference, we have big representation for respiratory medicine, big representation for medical and clinical oncology. What other kind of people are coming to BTOG, and who do we want to really get involved as much as we can?
Well, you know, if you're involved in the management of patients with thoracic malignancies, you should be a member of BTOG. And I don't really see how you can keep up to date in the really fast-paced, changing world of thoracic malignancies if you don't have a resource like BTOG to fall back on, both in terms of your delivery and your ability to network with peers. We want everybody to be involved. That includes radiologists, includes surgeons, includes pathologists, includes physios, includes nurse specialists, includes trainees, whatever your specialty as a trainee. And in fact, one of the things I really am very proud of is the fact we've got some superb trainee representatives on our steering committee, and we've got great trainee representation in what we do.
Yeah, and in fact, we've got the journal club setting up, haven't we? Which I think has been quite successful. And I think you're right, because certainly when I became interested in thoracic oncology, I didn't quite know where to go and what to do. And I think this would be something we'd encourage everyone to do. Okay, so that's kind of what BTOG is. That's the point of BTOG. How did it start? Who started it 20 years ago? Before my time, of course.
Well, absolutely. You were still in the nappies, I'm sure.
I was.
So, I mean, it's in fact an idea that was born in the late 90s, in 97. Of course, I was in nappies at the time as well.
You were indeed.
And at that time, it was an idea mooted between various people, initially at the World Lung Cancer Conference, the 8th World Lung Cancer Conference in Dublin, which Des Carney was hosting. And various people, including Ken O'Byrne, who's a medical oncologist, really wanted a UK and Irish specific group to be able to network, to be able to bounce ideas off each other, to be able to run research studies and to be able to disseminate information and to be able to ensure that the high standards that each of the individuals have for their patients can be disseminated throughout the British Isles and Ireland. And that's when the idea was born. In fact, it was initially going to be called Bristow. That was the original potential name for various reasons.
I'm trying to work out what Bristow stands for.
Yeah, I'm sure British is in there somewhere.
Yeah.
There then was a further meeting at the next World Lung Cancer Conference in San Francisco. I think that was about 2001. But actually, BTOG was actually crystallized as an organization in 2002 with colleagues mainly driven from Leicester, Ken O'Byrne, Dave Waller, Mick Peake, also others who are really important in the history of thoracic malignancy in the UK. Dennis Talbot, Marianne Nicholson, all played huge roles in ensuring that the UK got together to form a society that could really deliver the best care and best discussion for patients with malignancies.
And is that where the Dublin link comes from? Because something which is often people remember BTOG for is the annual meeting. They know it has been until recently in Dublin, and they get a bit confused. Dublin, of course, not being in Britain.
Yeah,
is that where it comes from?
Yeah, it is. Well, the first meeting was actually just off the M1 in Hinckley, which
glamorous.
Yeah, very glamorous. A couple of hundred people turned up. It's not bad for a meeting. It's a bit grim, I'm told. I wasn't there. Not the usual standards we have these days.
No, quite.
But it kicked off there, and then Ken was the chair of the organisation. He eventually moved from Leicester to Dublin and then solidified the meeting in Dublin. And, it's become a tradition since then. Ken moved to Australia. And, my view on most things in life is if it ain't broke, don't fix it. And it works very well in Dublin. So we kept it there.
Certainly does. Now, you and I are part of the steering committee, Collection of Good and the Great, but certainly in the past few years, we've had a bit more of a separation of steering committee and trustees. What are the trustees about? What do they do? How do they make sure we behave ourselves?
So, one of the things I did when I became chair is actually, we were basically just a group of people that are working together for a common mission and purpose. And so we've worked together over the last few years to make BTOG a registered charity. We're governed by the UK Charity Commission, which means we have to have a governance structure. And that's really important, actually, because accountability, independence, and governance are absolutely critical. We want to make sure that there is complete integrity in everything that we do. So the trustees are the people that vouchsafe our organisation. A learned group of 5 individuals chaired by my colleague currently, Martin Grange, who BTOG report up to, and they oversee everything that we do and, ensure that what we do is within the scope and remit of our charitable mission, which is enshrined in the legal documents that support our charity.
But the direction of what we do, the decisions we make week to week, month to month, is within the steering committee.
Yeah, fundamentally. So it's driven on a regular basis by the steering committee, and that's about 28 different individuals from different multidisciplinary backgrounds: oncologists, radiation oncologists, medical oncologists, pathologists, scientists, trials staff, nurses, trainees, patient representatives, the entire gamut of everybody involved in the field is the steering committee. And the steering committee essentially make group decisions on strategic priorities. They set the plan for work during the year and support us in the delivery of all of the aims and objectives that the organisation has within the remit of what the trustees approve.
And what about funding? Who funds BTOG? So it's more, we should point out to listeners, it's more than just an annual meeting. And we're very keen to talk about the number of facets we do. Where does the money come from?
Yeah, so the majority of the funding we get is from our registrants for the events that we run. We don't just run the annual meeting. That's one of many different things that we do. And the majority of the income that we get is from our registrants. We, of course, have sponsorship from industry, but we are keen to make sure that we have the appropriate governance and policies in place so that we manage that potential conflict of interest as you'd expect any professional organisation to be able to do. So our sponsors, our industry sponsors, for example, have no role whatsoever in the content or delivery of any of the programs that we run. They may choose to run their own program embedded for an hour within a a program that we run. That's a separate event that's run by them and branded by them as their industry marketing or medical talk or symposium. The funding is completely separate and they're independent.
So that's helpful to clarify. We talk about the other things we do. So we've got the annual meeting. We have obviously this outstanding podcast series, which you're clearly listening to. What other things are you particularly proud about that we do? Because there's some kind of things going on behind the scenes. So, for example, people may not know that BTOG has a representation to every lung cancer specific NICE technology appraisal.
That is one of the biggest pieces of work that we have to do. And, it's a huge amount of work. So every single appraisal in the thoracic malignancies field that comes to NICE, there is a BTOG representative at that appraisal, fighting the corner, making sure that common sense tries to prevail. And I have to say, usually, the team have done a great job in ensuring that happens. And you've got to remember, this is not just a meeting. This is a process which often involves several meetings, can be dragged out over the course of over a year. I can remember many appraisals which have been dragged out over a year. And these days we have pre-NICE meetings, we have CDF meetings, we have CDF revalidation meetings for NICE, we have reappraisal meetings. So it's a massive amount of work, and that's really a lot of the representation that we do to make sure that all this great data we're seeing in conferences is available for people up and down the country.
And it is very interesting. I did one a couple of weeks ago. I've got another one tomorrow because I'm such a hero. What's really interesting is that when you're there and you speak as the clinical expert, people do shut up and listen, which is a rarity in my life. But it's great, and you realise that if you're there representing an auspicious organisation like BTOG, you do have influence.
I think that's right, because at the end of the day, people want to know what the experts in the field think about certain aspects. And that's not just NICE, that's all aspects of policy. And BTOG, it contributes to many, many, many fields of policy. I mean, you and I have exchanged how many documents about our recovery from the cancer pandemic? I mean, if I have to write another one, I think I'm good.
You may not recover.
Yeah, quite. So, there's a lot of work that people don't see, behind the scenes in policy and representation. So
we've got the annual meeting. We've got the NICE stuff. We've also got kind of master classes and things. They'd be much more difficult to run, obviously, in the era of COVID.
Yeah,
we hope that may change.
They have. I mean, one of the things we've been doing is running our essential updates and also our masterclass series. They have previously been one-day face-to-face meetings pre-pandemic. If Boris is right, we'll be returning back to these, and I sincerely hope we do return back to face-to-face meetings before soon. We do run some of them virtually. In fact, we've run very successful virtual one-day meetings in screening and leading your MDT recently, and we do want to come back to face-to-face, but if we have to do things virtually, we'll do them virtually.
And if I remember correctly, I think a lot of those master classes are still available on the website. So there is a playback function.
One of the great benefits of being a member is you have access to the great and the good, giving their views. And all of these meetings are downloadable. Slides downloadable. So
essential questions now. We haven't had a BTOG annual meeting for a couple of years. Last one was January 2020. Seems like a million years ago. When do you think we will have? So we have a meeting in July in London, we believe, which is going to be face-to-face but smaller.
Yeah, 8th of July is going to be our summer meeting. We're all desperate to network, meet each other, and really chew the cud of data. And I think one of the things you and I both have learned is interactions with people over video are just rubbish. There's very little you can do. It's so artificial, and actually the best ideas are just when you're just sitting with a few friends, having a chat, and then suddenly something comes to mind and you think, wow, this is brilliant, let's take it forward. And actually that is really the spirit of BTOG. We're going to a face-to-face meeting 8th of July, and we want to go back to an annual meeting. We need to consider where it's going to be. We need to consider what it's going to look like. We need to consider what time of the year it's going to be. All of those things are being reviewed over the course of the next few months, depending on how things pan out.
And I'm going to put you on the spot. like a politician? Will it be back in Dublin? Will it be in January, or are we going to go for politician's answer of what time will tell?
I think time will tell, but I think knowing what we've seen with winter pressures, that doesn't look like it's going to ease anytime soon. I think I'd be a bit surprised if it's in Dublin in January in 23.
Yeah, I don't. Winter does seem to be not a great time for trying to get together, by and large. Yeah. But I do feel, I feel if the July meeting goes ahead and goes well, then that's our beginnings of our ticket out of this situation.
I think that is, and we need to think about, where we go with our annual meeting. Do we need to have franchise local meetings? Each alliance has the ability to host their own lung meeting. It'd be great to have a BTOG rep, somebody beating the BTOG banner for each cancer alliance, and running a program. I'd love to see that happen, because there's so much pace of change, Tom. It's really hard to keep up to date, and facilitating great ideas, making sure that we're getting patients recruited to trials, studies, the whole gamut of the experience.
Yeah, I would very much look forward to the face-to-face meetings. I remember my first BTOG was in 2011, so I was appointed 2010, and I remember very clearly walking into the hotel in Dublin. I knew 3 people, of which you were one, and I left after 3 days knowing about 50 people. And then the next year I came in knowing 50 and came out knowing about 300, and that's going to continue. And I found it absolutely indispensable from someone who didn't really know anyone in the lung oncology world.
I agree, and the best thing that happens at BTOG meetings, you say, well, I saw that case and I wasn't sure whether I should do A or B. What do you think? And you'll have a chat, and then you'll both agree that A was actually the right answer, and then you'll think, right, that's brilliant. And then it's that sort of crystallization of data in real life and context that really does help move the field forward.
So 2 more questions in our last couple of minutes. Number one, what next for BTOG? We've talked about hoping to get the face-to-face meetings going. Are there any other things that you have up your sleeve, or the steering committee have up their sleeves, that we might be focusing on in the next year, apart from getting together again?
Yeah, thymic malignancies is a big area of interest. We've launched a thymic interest specialist group, which my colleagues are setting up and running very efficiently. David Gilligan is chairing it, and we'll be seeing a lot of this activity over the course of the next year. We will be, producing consensus documents, guideline type of documentation, really to help focus the field in British context, along with probably a research brainstorming meeting at some point in the next 12 to 18 months, depending on how COVID pans out. And that's, on top of the regular webinars, the education series, the everything else that we do with NICE, for example.
Yeah. Some of us who are longer in the tooth will remember BTOG2 trial, seminal study. Is there going to be a BTOG3? Is that part of the BTOG remit, or is it actually very difficult to flag a study like that? And have we been slightly replaced by the other research structures in the UK?
Well, in the UK, you can't do a study unless you have NIHR adoption. That's just the funding infrastructure that we have. But there's no reason why, if an investigator has a bright idea that encompasses UK feeling, that it can't be, branded as a BTOG study, like a BTOG3, BTOG4. And I'm very keen that we, use that brand to ensure we have UK reach with our research studies. So, I think one of the things that we will be moving forward with in the next 2 years is our research agenda as well, which I think is complementary and not competing with the NCRI agenda, which is quite different.
And that brings us very neatly on to my last question, which is, we're going to have thousands of people listening to this, obviously, and they're all going to be saying, how do I get involved? How can I do more? I guess number one, we would say become a BTOG member, which you can do through the website. How else might people get involved if they're interested in BTOG and what we do?
Well, if you've got bright ideas for things that you want to hear about on a webinar or a podcast, or a topic that you think is really undeserved, that needs overview, just write in info@btog.org. Just write in with your views. If you want to give up some time to do something locally, we can support that. You know, we want people that are going to be part of the solution, not part of the problem. So, you know, come and join us, be part of the solution.
Absolutely. We've got lots of problems, need more solutions. Brilliant. Well, that takes us to the end of our allocated 20 minutes. So thank you very much, Sanjay, Popat, for joining me. Thank you, everyone, for listening. We hope that gave you an insight into the wonderful world of BTOG. You won't be surprised to hear that for more information on BTOG and everything that we do, you can visit www.btog.org. And thank you very much for listening.